Okay, we are live on Las Vegas Triathlon Club Facebook page. We're recording. I'm John Mercer, president of Las Vegas Tri Club and faculty at University of Nevada, Las Vegas. And it's Friday night. I've got Ted Girard here, ambassador for Las Vegas Tri and faculty at University of Nevada, Las Vegas, and athletic training education program director. Hey, Ted, how's it going?
Good. Yeah. Good week. Getting ready for the weekend.
Yeah.
Get back to a little bit of normalized training or normal training.
Yeah, I don't know if what you're going to do this weekend is normal. We were talking a little bit beforehand. You got another long ride.
Gonna do another 100 on tomorrow, actually. So we're gonna work with somebody to help them get their first 100, and yeah, it's gonna be good. I'm looking forward to it. The amazing thing is this, John. We talked about the Everest thing stuff and waiting for a cool weekend. I still would be waiting.
Yeah, that's right. That's right.
So the people that are listening in that are not in Las Vegas, we have had a hot fall.
Yeah.
And normally this time of year we're not seeing 90s for highs, and we're still seeing 90s for highs. So yeah, I really thought I would be, normally we're like 80 for a high at this time. So yeah, it's
Halloween always gets cold on Halloween. So maybe we're still going to get there.
We'll see. I'm not counting on it this year.
Yeah.
So how you doing?
Oh, doing good. Actually, I just realized I brought this upstairs. I brought up my finisher medal.
Yes.
For my Willow Beach to Charleston Peak.
Now you put a little band around it, I noticed.
I did. I put my wristband on it. So
nice. I love it.
This is my piece. I don't think I showed this to anyone, but it's my piece of charred wood from the Charleston summit where the forest was burned down, and I was getting all philosophical at that point. I'm like, oh, it's actually got a lot of new growth around it. And so that's why we do these events, is you burn things down and then you have new growth. So
yeah, it's funny because that's some of the things we're going to talk about today. So that's good.
Yeah. So let's go into that. So
well, should we make our announcement first?
Oh yeah, thanks. So
let's make our announcement. It's an exciting time for us.
So we have decided to actually launch a podcast, and we came up with the name Evidence-Based Triathlete.
Yeah, it's going to be awesome. I'm pretty excited. We've been toying around with this for a while. I think it was almost a year ago we started actually talking about, could we do a podcast? Should we do a podcast? One of my kind of fears was that we wouldn't have much to talk about. We kind of cover off everything, but I tell you what, every Friday night when we've been jumping on and having these conversations, it's been great, and we're getting good feedback. A lot of people are tuning in. And if you think about it, we have a really small audience that we've kind of pushed this out to, basically just the triathlon club and some of our students at the university. So, I think there's a lot of potential for this type of information. So yeah, I'm pretty excited about it.
And I think the unique blend of what we're doing is, one, you come at this from a very clinical perspective. You've got years of great clinical experience and teaching experience. And then you also partner on different research projects. Whereas I come at it more from a research end, and I've got a little bit of clinical experience working in clinical ex-phys for a while.
Yep.
But so we sort of meet in the middle and bring different perspectives of something. In this case, that something's triathlon.
Yeah, but also we have the perspective of evidence, right? Like both you and I are into the evidence of things, and we're interested in triathlon. I think I'm mostly interested in triathlon, honestly, because it's the application of evidence, right? The training we do is literally the application of evidence.
Totally.
And neither of us are perfect in triathlon, right? And neither of us are completely, 100%, I guess, utilizing the best possible evidence. We're trying to, right? But there's just so much evidence out there. And then there's also, the individual variability that plays into it, which is part of the evidence, which is, this is all quite exciting, to be honest.
No, so true. And I think the one value we both share mostly is we're triathlon nerds. I mean, we just love everything about triathlon. So
although I got to be honest with you, I don't necessarily love everything about triathlon. I was swimming last night and I was like, I don't know if I really like this. We keep coming back to that. I
Yeah.
love triathlon, but I don't love swimming. And I'm trying to love swimming. I don't know what it is. I'm trying though.
Yeah.
I got to figure out something to love swimming, I guess. I love running and I love biking, but I don't love swimming.
Well, that's 2 out of 3. That's not bad.
It's not so bad. That's not
Yeah.
so I endure swimming. But
But
it's
I think,
funny because when there's no races on the horizon, it's a lot easier for me. Like, man, maybe I won't swim tonight.
yeah, right, right.
You
See, and I
know?
love the swimming.
Yeah.
But what I think what you do enjoy is getting behind on the swim and then catching everyone on the bike and the run.
It is
So,
pretty fun. I actually feel for those people that are great swimmers and then they get passed.
yeah, right.
There is that caveat. So anyways, yeah, so we're going to be working diligently to actually turn this Friday night conversation into a podcast. We're going to have some segments. We're going to talk more about some research. We're going to try and answer people's questions in regard to triathlon, and yeah, we're going to try and keep this going as long as we are enjoying it.
That's
Right?
right. I was just going to say, as long as we're having fun and enjoying the topic and the discussion, then we'll just keep doing it.
Yeah. And maybe we'll only keep this going till we get a COVID vaccine and we can actually go out with our significant others on a Friday night.
Well, yeah. Well, we can do this remote. Well, we're doing it remotely now. We can do it even more remotely at that point.
Exactly.
Oh,
So
good.
yeah, so that's the big announcement. And then tonight we are going to talk about cryotherapy and ice and its implication in injury recovery, short-term recovery, long-term recovery, training impulses. I'm actually really excited to talk about this because in the world of athletic training, this has been a very controversial topic,
Oh.
and the pendulum is swinging very hard away from ice.
Mm-hmm.
For years, ice was the panacea.
Yeah.
Right? Like anything. Oh, I hurt my hamstring. Well, get some ice on it. Sprain my ankle, ice it. I trained really hard. Oh, ice bath.
Mm-hmm.
And it was done, kind of we always did it.
Yeah.
And a lot of research early on in ice was somewhat, we're looking at back now, it was somewhat flawed. And, the theories never seemed to match up well with what actually was happening clinically. And so, yeah, there's been some definite paradigm shifts, especially in the last 15 years.
Mm-hmm.
But as we know in evidence, there's always two sides to every story, right? And even when there is good evidence, when something is so ingrained in people's mindset that it's very, very difficult to change.
That's that anecdote evidence. But, this is also a good sign of science, because that's what science does, is you keep testing hypotheses and you keep trying to rule them out. And so that is progress. Sometimes it's slow progress.
Yeah. Well, it's hard. I think it's really hard clinically to make progress when we have something that is so ubiquitous, right?
Yeah.
Like everybody knows when you injure yourself, you put ice on it. Yeah. Everybody knows that. Yeah. And those are the hardest ones, right? Mm-hmm. It's really, it's really, really difficult to make big changes. I mean, we can make a comparison to the nutrition industry. Mm-hmm. Everybody knows that that dietary fat causes heart disease. Yeah. Well, the pendulum has switched on that as well, right? But it's still, we get marketed to all the time that low fat is good. Yeah. And you talk to people in clinical nutrition, and they tell you that this is a big issue of switching a paradigm switch when everybody knows something is true. Mm-hmm. And right now ice is in that world. So I'm going to start out talking about injury, and then we'll move into performance and recovery.
Okay. And I want to throw in some running injury stats.
Yeah, let's do that.
Okay. So let's take 100 runners training for a marathon. Yeah. The number of them that will get some type of injury, and I know you're going to want to define that, and I'm going to let you do that. They're going to get some type of injury, probably about 75 of them out of that 100. Again, it depends on how you define injury, but Out of those, probably another 25 of them will have to stop running because of the injury. So
Well, I think it might be even more than that.
yeah, well, I mean, completely stop and take maybe 2 weeks off and not be able to run. And there's lots of different stats on this. The trick is when you start looking at the literature is the definition of what an injury is. And in this case, I'm referring to overuse injury. Okay, now let me bounce it over to you. Tell us about injury from your end.
So, I guess that's perfect segue, because what we really do need to talk about there is the difference between an acute injury and a chronic injury.
Yep.
Because what you're talking about in those athletes is, I'm going to say, out of the 100, one is going to have an acute injury, right? So they're going to trip on a curb. They're going to be running at night and fall. That is completely different than when we're talking about, the typical triathlete / runner injury. It's almost always an overuse injury. Okay. And when we really start to think about injury, and we need to really do think about the classification and how we do that. And we'll talk more about injury in some other podcasts. I got some great ideas to go down that road. But if you really think about injury in the chronic sense, what actually is it? So I'm going to ask you that, John, like from, I know this is not your area, but if somebody was to, well, if it was you or your wife was to say, I injured my hamstring running today, in your mind, because I don't know the answer to this because I'm so ingrained in this. What is it?
So
what is that hamstring injury? What is it?
Okay, so let me answer from a research perspective, because we do a lot of research on injury mechanisms, especially during running. Is we've done a lot of research on ground reaction forces, shock attenuation, muscle activity, trying to understand why runners mostly get injured and mostly have an overuse injury. So from that perspective, an injury is anything that would interfere with the ability to run.
Yep.
Right. So for a very broad definition.
Okay. So
now,
what's happening in the person's hamstring?
What's that?
What's happening in that person's hamstring?
Okay. Now that's where I draw the line in terms of what I do. At that point, my research is more focused on the injury mechanism. Now, here's the problem with a lot of our injury mechanism research is we actually study healthy runners. And the problem with studying injured runners is that every injury is so unique. It's hard to group people together to be able to study a group of people with a hamstring injury because they're all going to be a little bit different.
Okay. So now take your research hat off.
All right.
Okay. You're just John the triathlete.
Yeah. Every time I run, I get injured.
There you go. But what is it? Like, what is the injury? Is it the muscle being torn? Is it the tendon being torn? Is it like, in your mind, what is it?
Well, it can be any of that. Now, and I'm sort of kidding.
But is it?
Every time I run, I get injured because every time I run, I do some damage.
That's
and
it.
Then my body has to respond to that damage. And that response is, it's the new growth.
Yeah. But here's the thing, John, you're now answering me as a researcher, right? And you're not answering me as the average triathlete, because part of injury is actually the psychological component, right? Is actually when you get injured, it's like, oh my gosh, I tore my muscle, or I've damaged myself. And really what an injury is in the chronic sense is, you are right, it is the accumulation of damage over time that has not been repaired properly, that we have not allowed to repair properly. And so if you really think about it, when you train, the way I like to think is like a cup. Okay. So when you train, as you train over years, you build yourself a bigger cup. So you go from your little juice cup up to the big beer stein, right? So like world champion athletes, they got a big beer stein. And the idea is you build a bigger cup, you can actually take more load on. You can take more basically beer into your cup. Okay. And as long as you don't overfill the cup that you've built over time, you're not going to get injured. But the problem is that we don't build the cup very fast. Right? We build the cup over years and years and years. And if you have a 6-ounce cup and you do 7 ounces, put 7 ounces worth of beer in, 1 ounce is going to spill out, and that's you getting injured.
Mm-hmm.
And you are absolutely correct that every time you run, every time you bike, every time you lift weights, every time you do something, it's not necessarily always doing injury, but it's just filling up into that cup.
Mm-hmm.
And the release of that cup, the drinking of it, right, is your recovery time.
Yeah. No, I like that. And
yeah,
I'll say injury is not a binary thing. It's not a yes, I'm injured or no, I'm not injured. It's a
Yep.
continuum. And so I love your analogy because that is describing that continuum of injury. And I really like how you pulled in the psychological aspect. There's actually some neat research on this where
Yes.
another biomechanist, he actually took a whole bunch of biomechanical measures of a group of runners and then tracked them over this preparation for a marathon. And none of those measures actually predicted injury. But the problem he ran into was what people were individually reporting as an injury.
Yep.
And some people were maybe over-reporting that they were injured, and other people were probably really injured and under-reporting their injury.
Yeah. You know, the quickest way to make somebody feel injured is to show them an MRI of themselves.
Oh, really?
There's a lot of good evidence on this. Like you should probably never look at your own MRI, right? Because you start to see things in it,
Yeah.
right? And the doctor's like, you see this squiggly line here? That's your muscle being torn. Ooh.
Yeah.
And then the mind kind of takes over, and it's like, oh my gosh, I have a torn muscle in there.
Mm-hmm.
We can imagine. Your mind starts to imagine that there's an actual tear in there, and the response is you get the psychological response, and there's a big role of that. There's been several studies on especially shoulders and labral tears or cartilage tears in the shoulders, and people if they see the MRI versus if they don't, and how long they're injured for, or if surgery will work versus conservative therapy. Same with low backs and disc pathology. They actually, some of the research is really clear on this. You should never, ever look at your own MRI of your back.
Interesting.
Because your outcomes get way worse if you see the bulging of your disc.
Because you don't know what to compare it to.
You don't know what to compare it to. And we do know there's a lot of people with bulging discs that have no back pain.
Yeah, right.
Right. There's actually a poor correlation between like a bulging disc and back pain. And it's the same with other muscle injury. Is once you can, you see something, and nowadays we're doing this with ultrasound, and you potentially could just see a shadow of something, and like, oh, that's not, that doesn't look normal. And most people aren't schooled enough to even look at those things and determine, the pathology.
Yeah.
So I think that does play a role. So if you think about it, like we've been talking about, basically what you're talking about is breaking down faster than you build. That's truly what we're talking about with a chronic injury. And you get to the point where you've broken down more than you can build, and your body will respond with pain. And that's the easiest way to do it, right? There's thinking about it, because we're already going to have inflammation. Because inflammation, we'll talk more about inflammation. Maybe not today. We'll touch on it a little bit, but inflammation is critical to this whole
natural
thing.
process. Yeah.
When I exercise, if I, this is actually pretty important. If I was to go exercise and I could take something, a drug that blocked all inflammation, I might as well not have exercised, right? Because I need to break down, have an inflammatory response, which signals building. And then that building makes me stronger. If I don't have an inflammatory response, I actually am going to get weaker over time. It's one of the reasons we do not advocate the use of anti-inflammatories, right? Because an anti-inflammatory will actually block that. Because we have good injectable anti-inflammatories. We can give you an injection. Well, I can't. Someone can give you an injection of an anti-inflammatory like a Toradol, which will basically block the inflammatory response, decreases your pain, but you will not recover the same. And ultimately, this will slow your progress. And so that's kind of, and it's an important thing to understand that inflammation in response to training is not necessarily a bad thing.
Right.
And we oftentimes always associate inflammation with bad. Now, chronic systemic inflammation, different mechanism, is a bad thing. Because we know that it can lead to heart disease, that can lead to macular degeneration, and all these other pieces. So, obviously we work at a university, and I got a chance to talk to one of the professors there who does a lot of work in the inflammatory world. And I asked him, said, if you had somebody ask you, like me, is inflammation good or bad? He's like, can't answer the question. It's all contextual. Chronic inflammation, bad. Inflammation in response to injury, good. Inflammation in response to chronic training, good. And the things that we do to alter the inflammatory cycle can have very negative effects. And for a long time in the world of athletic training and sports medicine, we have just ubiquitously iced everything.
Yeah.
Because we really did think, and not just iced everything and gave anti-inflammatories for everything, because we thought that inflammation was bad just in general. Now, fortunately, we've moved forward a lot in that world. And if anything, a lot of the things that we do now actually increase inflammation. So if, for example, you were to do an instrument-assisted soft tissue massage, so Graston, that's a pro-inflammatory thing. Massage is pro-inflammatory. Exercise is pro-inflammatory. So, we're actually pushing off now into creating inflammation. Even dry needling is inflammatory, right? So all of these things are inflammatory. So then the question is as well, should we still ice? And I'll tell you personally, I have been in the triathlon game now for 10 years. I have put an ice bag on myself a grand total of like probably 4 times. And it's always been post race.
Yeah.
When something was really, and I was in pain. And this includes when I injured my shoulder really bad.
Right.
So, but I did it only for pain control, right? Because I wanted to actually be able to walk around. But I also understand that when I do that in a short amount of time, that it does act as an analgesic, as a pain control device that is non-pharmacologic, which is good. But I didn't do it thinking I'm going to decrease inflammation and slow the healing process. I did it because I wanted to be more comfortable. And so that right now in sports medicine, that's especially with chronic injury, actually even acute injury, really ice is now being reserved for pain control, and not for its use as an inflammatory or an anti-inflammatory. So, anyways,
all right. Well, let me ask because I'm not up to date with the treatment, so this is really interesting. But anecdotally, people will do cold baths after a workout. I know you sent me a paper on this, so
yeah.
I mean, what's the deal with that? I mean, that seems to make sense.
It absolutely does make sense, because you're going to decrease the inflammatory process.
Yeah.
So this is the whole thing with this, is that if I work out really, really hard and I get into an ice bath, it is going to decrease my pain and it is going to decrease the inflammation. But if you take a step back, I exercise to get inflammation, to stimulate that, right? Or I exercise, I broke things down. I need the inflammatory process to rebuild me. So if I'm looking for long-term benefit of training, so, I'm trying to build my chronic training load over time, trying to build my fitness over time. If I chronically ice bath, I will actually feel better, but I will not gain the benefit as much of training. So, and let me give you a good example of when ice would be a really good thing to do in an ice bath. If you had to do 2 hard sessions in one day that really mattered and you had to perform in both of them, ice in between would be great, because you are going to basically blunt the inflammatory effect. You're going to decrease muscle soreness. You're going to actually be able to even produce more power later that same day. So, I used to work in soccer. And so if we had a tournament, for example, we had a game in the morning and a game at night. Between those two games, absolutely ice baths would be a good thing to do, because I need to perform again before the cycle of inflammation can basically be resolved. Right? But if, let's say, I wanted to long-term make myself better, so let's say I played a game on Wednesday, I played a game on Friday, I played another game and had practice along the way, and I wanted long-term increases in performance, I wouldn't want to be blunting the training effect, right? So I'm trying to think of a triathlon example of when you would want to do that. And I can't think of one where I do 2 triathlons in the same day.
Well, I'm trying to think, what's the super sprint?
But it's all one.
It's still
right?
one.
Now, if you're doing, sorry, not the super sprint, but the super league, where it's over a weekend,
league,
yes.
Right.
And you had time in between, because I think they do 2 things on Saturday, 1 on Sunday. Absolutely, you'd want to do that.
Yeah.
That would be the time to do it, right? But let's say I'll give you another example. Let's say you had 2 hard sessions in one day.
Yeah.
Your coach on your training peak says, okay, you're going to go do hard work in the morning, hard work in the evening. Maybe you would do it so you could kill that second session. I would say your programming is wrong. You should do a hard session, then recover before you do another hard session, right? So those would be the at least what we're seeing in the research as kind of the balance. So yeah, I did send you a paper, and the paper basically was looking at the trying to figure out the reasoning behind this. And so we can share the paper, but the big thing is that and this was a strength training paper, which there has not been an endurance paper yet on this, which I think there will be. Was looking, number one, at testosterone levels. These were males, and basically it showed that after you exercise, after you lift weights, these guys did 6 sets of 10 squats, and then they either went into a cold water immersion or they didn't. There was a control group, and it basically showed that within 15 minutes, the testosterone that was in the bloodstream was significantly less in the group that did the cold water immersion. And that's one of the things that we want, right? Testosterone is an anabolic androgen that it's basically critical for building. And that's one of the responses to exercise that we want to have. And so they're trying to figure out, this is pretty high level stuff as to why we're potentially getting this happen or have this happen. The other thing is there was a few other inflammatory markers that they looked at, TNF alpha and IL-6, which are also inflammatory markers, and it definitely had an effect on both of those as well. So that's kind of the side of this. But as an individual athlete, here's the difficult part: is it makes you feel better, right? So I've worked with lots of athletes, and a lot of them hate going in the cold tub, but they also love it, because they're going to have less muscle soreness, right? So the next day when they go and run again or do whatever they're going to do again, it's going to be they're going to be less sore. But the cost long term might be decreases in performance. And honestly, we're talking potentially about 1 or 2% difference over maybe a month or two of chronically doing this. And to the average person, maybe that's no big deal, right? I'd rather feel good and have 1 or 2% less performance.
And so, the cold water immersion, the cold water part of that in this study was 15 degrees Celsius.
Yeah. Which is right in the window for what we would do clinically in athletic training. Yeah.
How about at home? How would I get 55 degree?
Oh man, John,
Just bags of ice and
buy bags of ice. But honestly, like there's a movement in the wellness world. And now the wellness world is different than the performance world.
Mhm.
But where you can actually go online and buy, there's a company that actually makes, this is pretty cool. They make it's a chest freezer that they seal, like one that you maybe have in your garage, or
Mhm.
yeah, and you can just plug it in and you can set it to 55 degrees and it's always 55 degrees.
Oh,
Yeah, and there's something to be said for actually, stimulating parasympathetic versus sympathetic nervous system by doing cold water immersion. And I'm not talking about that at all,
mhm.
because there is some benefits of cold water immersion on the nervous system
Mhm.
and on either relaxation or potentiation of the nervous system, depending on what you do. So, and honestly, there might be some benefits to that if it can help you relax and maybe you sleep better. There's good evidence for people doing like cold showers before they go to bed that helps them sleep more. But what we're talking about is like, you finish exercising and then you put your legs in a cold tub.
Okay, so let me make sure I'm following.
Yeah.
So as a triathlete, I get done with my workout, with whatever it is, I'm done for the day.
Yeah.
If I need to maybe do another big session the next day, or if I have potentially a race or a performance, cold water immersion is probably useful at that point.
Yep.
Okay.
But the question is, why would you do that? Why
So
would you have 2 big days in a row
yeah,
other than Super League?
no, that's true. Yeah, no, that's a good point. I mean, I can't come up with a good reason other than I just want to have 2 big days in a row. Maybe. Okay, so
Okay, yeah. So if that's your reason, let's say you're gonna go for a 400-mile weekend or 300-mile weekend on your bike.
yeah, okay, yeah. So there could be
So
that. It could be a stage type of ride. Well,
yep.
what about if I do this? So pretty much weekly. I do a big swim on Friday, then I do a big run on Saturday, and then I do a big run on or big bike on Sunday. Should I be doing cold water immersion between any of those?
Would you want to decrease the training effect of any of those?
No.
That's what I would look at. You might as well just swim less,
All right. So
right?
then,
Or run a little bit less.
okay, okay. So then, I guess if I had a race on Sunday, maybe that would be the only time that I'd want to.
But why would you train hard on Saturday?
If the
Just train a little bit less hard, and then you'd have the same effect.
no, I'm trying to understand when to do cold water immersion.
I don't.
Don't. Okay. All right.
Now I will give you a few little pearls
Yeah.
of when you can do cold water immersion. When you finish your Ironman,
Mm-hmm.
do you really care about the training effect of your Ironman?
No, I don't.
No, because you're going on rest and
Mhm.
recovery mode for a while, right? And probably you went way past the training effect.
Mhm.
And so I cold water immersion after a triathlon, probably not a bad thing, especially if it was hot,
Yeah.
because dropping your core temperature might actually be really advantageous for your
Mhm.
recovery, because this is different,
Okay.
right? So if your core temperature, and we've done some core temperature work, if your core temperature stays elevated for an extended period of time, that actually can affect your recovery.
Mhm.
So doing a whole body cold water immersion for a short amount of time to drop your core temperature might be advantageous.
Okay.
Okay.
All right.
So, but I would say also you can do that in 80-degree water, not in 56-degree water. So
Okay. So that good. I like this because now as a triathlete, I always say, okay, if a little bit of this is good, a lot is better.
yeah.
So if some inflammation is good and you're telling me don't get in cold water, then after workout, I should be jumping in the hot tub.
And honestly, that might be where the research is going.
Yeah.
Because what we're seeing is when people do that, we're actually seeing that the training effect can be amplified.
Mm.
And we're actually seeing increases in blood plasma volume.
Mhm.
And when people are doing heat acclimatization work, that's exactly what they're doing these days.
Mhm.
is they're working out in the hot, and then they go into a hot tub, or they go to a sauna afterwards, and they can keep their heart rate elevated for an extended period of time without actually even exercising anymore. And they're seeing increases in blood plasma volume, which it's a thing, and it's what people are doing. It's dangerous a little bit if it's not done properly, right? Because you do still have to hydrate yourself, right? You actually, that's one of the things, you don't increase blood plasma volume unless you're hydrated properly. Right. So don't just, don't take my advice and just go out and train in the heat and then jump in your hot tub for a half hour without making sure you're hydrating. Right. But yeah, that's a thing. That's a real thing that people are doing. And then I'll take it a step further, John. If you're just talking about an injury, which we kind of started with on this, I absolutely, I usually don't do it in the first 24 hours, but I'm heating my injuries. And I'm heating them in different ways. Either with
local heat, or you do
local heat, like a hot pack, ultrasound. I mean, I'm privy to an ultrasound at work, shortwave diathermy at work, which is a really expensive way to heat yourself deep. It's like microwaving yourself. But soft tissue mobilization, like your Graston type things, that creates local heating. So yeah, I actually think that this is, it's what we're doing. And think about exercise is heating too. Right. And the whole idea behind heating is we're increasing the local metabolic rate, or the metabolic rate. And we need that increase in metabolism, an increase in blood flow to the area to bring the bad stuff out, the injured necrotic tissue, and bring good stuff in. Oxygenated blood with nutrients. Right. And one of the things that ice would do is slow that process down. And here's the other thing I will tell you. Back to, and then we're kind of jumping around a lot, but back to the acute, let's not even go there. Let's not talk about acute injuries, because that's not really what we're talking about here. But let's say I was going for a run and I came home and oh man, my hamstring, that's just killing me. I wouldn't ice it. I would wait probably a day, and then I would start utilizing heat. And I would be doing things like foam rolling and active movements, going for walks, starting very basic movement activities. I would do some other, there's other little tricks that we can get into down the road as we talk about, mitigating injury. But I definitely wouldn't put an ice bag on it. And this is, I've been a certified athletic trainer since 1995. I've dealt with a lot of athletes. I fought a lot of athletes over ice. I just clinically never saw the benefit. Other than pain control.
So on that,
somebody breaks their arm, throw a bag of ice on it. It decreases their pain and makes them more comfortable.
So let's talk about heat then. So let's talk about that hamstring injury. Do I put the electric heating pad on it? Do I put a washer in the microwave? And
the problem with those is your body is so good at dissipating heat, right? And what you can stand as far as heat compared to your body's normal temperature is so tight, right? So think about, what's your body's normal temperature? Well, it's 98 degrees-ish, right? You can't stand much more than 110, 115 degrees, right? So it's not like you can bring that level up too much. And that's part of the reason why exercise is so good, is actually we can increase temperature locally. Or if I put a heat pack on you, the kind of evidence shows that you might get a centimeter of depth penetration. Well, your muscles are way deeper than a centimeter. Right. Now, the nice thing about heat, I will tell you this, is it's also analgesic. Heat decreases pain as well. Right. So oftentimes we put heat on that'll actually make you feel better. And then we didn't get into the physiology of this, but there's also like localized muscle spasticity, or spasm, or hypercontracture. And heat and cold can actually break that spasm. So it's called the pain spasm cycle. So just by having you put heat or cold on can actually relax you. So, you know, you can use heat for that as well. But it's mostly acting like as a modulator of pain.
Okay.
But to get deep heating, you gotta spend a lot of money to get
Yeah.
these modalities that can actually, you know, get deep into you. So, you know, like therapeutic ultrasound, even we're looking at 5 centimeters deep.
Mm-hmm.
And, you know, 5 centimeters, that's not even 2 inches,
Yeah.
right? And so, you know, you think about your like a deeper hamstring strain or a glute strain or quadricep strain, you're probably not getting the actual heat to the area.
Okay. So now
Yeah.
in my race swag bags, it's not uncommon to get some packs of biofreeze or some
Yes.
of
Let's talk about that.
menthol something. So yeah. So what's that doing?
That is doing something that is this gets kind of deep, but these are called counter irritants.
Mm-hmm.
And so what we're doing is we're kind of tricking the neural system, the neurologic system. So and the easiest way to think about it is from the from the external part of your body. Let's just take my hand. Oh, put my hand here. My hand here. So my hand is always sending information through my spinal cord up into my brain. Okay. And there's lots of different sensations. We remember this from like, you know, elementary school, right? So we have touch, we have vibration, we have hot, we have cold, we have pain. I'm sure I'm missing some, right? I have joint space awareness or kinesthesia. I know where my hand is in space. All of this information is coming in. There's only so much bandwidth. This is a good way to think of it. That's actually getting through into my brain. And things that go through this work in different nerves, and some work fast and some work slow. Okay. Pain, thankfully, works very slow. Things that irritate us, like actually those things which technically are causing little chemical burns, they actually work really fast. So there's different nerve fibers. So pain goes along C delta nerve fibers, and those are really slow unmyelinated fibers. Whereas when I make chemical burns on my skin and chemical reactions on my skin, those go under myelinated fibers that actually go really fast. And so when I get to my spinal cord is going to take the stuff that's coming in faster, and it's going to basically what's the word I'm looking for? Put it in like a hierarchical order.
Mm-hmm.
And it's going to say the things that are coming in faster are more important. So I'm going to feel that sensation more than I'm going to feel the pain. It didn't actually make me any better. It's just changing my perception of it. And it has really to do with the speed of nerve conduction velocity. So that being said, let's say you had a hamstring injury and you're like, oh man, I really want to race today. My hamstring is buggered, but I paid $800. I'm
Right.
racing today. So you bathe your hamstring in a biofreeze. You might be able to get through the race, right? Because now especially if you keep putting it on over and over again, but all you're doing is just changing the perception of pain. Mm-hmm. You're not making your hamstring any better. If anything, you might actually make it worse because you're kind of hiding and masking. You're masking the pain. It's the same if I was to be able to give you an injection of an analgesic directly into your hamstring, right? It'd be very unethical to do that because you would no longer, basically feel the pain and, the pain signaling to slow down and to stop. But we could, you could do it, right? But it wouldn't be maybe the best thing to do.
No.
I'm just saying.
Well, what's interesting about the menthol is now people are looking at using that for hot races.
Yeah.
Putting it on you I don't know if the mechanism is actually to cool or to trick the brain.
Well, it's both, right? Because the menthol itself evaporates off of your skin quicker than water. And so it actually is taking, because, you know, when we evaporate, we lose energy a lot, very, very quickly, right? We lose thermal energy very, very quickly. So it actually is probably cooling your skin, but it's not cooling your core any faster, right?
Right.
But when we race, I had no idea we were going to go down this road, but it's kind of fun to talk about. When we race, the perception of heat, and you've done a lot of research in this area, the perception of heat is more important than the core temperature, right? The wetsuit study you did, where we looked at it and people felt hot, but their core temperature was the same because it was the skin that was getting hot, right? And it's the same, for example, like wearing a helmet, you know, that's maybe has less vents and more vents. The research shows that the core temperature doesn't really change, but you feel hotter, and that feeling of feeling hotter will slow you down, right? Because that's a mechanism we have. It's a psychological thing. If you feel hotter in a race, you'll go slower.
That central governor model.
It's central governor, but it's also, it's a real thing, right? Like I don't know how much it's truly central governor, or if it's just a protective mechanism that we developed through evolution that says, you know, I'm feeling hot, and if I keep feeling hot, bad things are going to happen, right? And we don't have a good mechanism in our brain to know if it's core temperature versus skin temperature, because in, you know, our temperature center is in the center of our brain. It's an area called the hypothalamus, and it actually receives signaling from both the core temperature blood, but also neurally from the skin. And it's a tough thing, but we can use it to our advantage too, right? So in a race, we also know that we can run some pretty high temperatures for a long period of time and not actually get heat stroke. And we can utilize things like these menthols and ice on the skin to actually make us potentially feel less hot. You know, when I did the Everesting, one of the best things ever was, you know, the cold packs on my back, right? It didn't change my core temperature one little bit, but the feeling of feeling cooler, right? Or just pouring water on my head, and it, you know, wasn't even ice water, just water on my head. It just felt cooler, and I instantly, you know, my endorphin level went up, and I just felt better. It didn't change my core temperature. So I think the perception in those cases is also important.
All right. So I know you didn't want to go down the acute injury path, but I got to ask you still, though.
Yep.
I'm running, I twist my ankle.
Yep.
Is that a time to ice?
Yep.
Is it? Okay.
Yeah. But here's the thing. It's a very short window of time.
Okay.
So the most current literature that I've been able to come across, and, you know, talks that I've been to, is probably within the first 6 hours, it could be a good thing. And I'm saying it could be. But past 6 hours, you're actually starting to mess with some of the primary mechanisms of inflammation. And there's some cells called macrophages, which are basically, they do the heavy lifting and removing bad stuff. And they get in there about 6 hours. And you do not want to, the talk I went to is called "Don't Mess with the Macrophage." And that happens at about 6 hours. So, you know, probably a good rule of thumb would be, in an acute injury, ice it 3 times for a half hour each. So go a half hour, take a couple hours in between, half hour, a couple hours in between, one more time, and then that's it. Now, we have some other mechanisms that we could really utilize here that are good and that people often don't do. And number one is compression, and intermittent compression, especially, because we can actually speed up these processes and speed up the cleaning up of things by, and this is a whole area of that's being more researched now than ever, is, you know, through the lymphatic system, and doing like lymphatic massage and lymphatic movement of things. And we do that with intermittent compression and even just compression. And you actually don't need a lot of pressure to actually stimulate the lymphatic system. And movement associated with it, just like light movement. Forever we thought, well, just hold the thing as still as possible. No, that's probably not a good thing either. But that's, I mean, honestly, we'll actually have at one podcast, I have a friend that does a lot of work in lymphatics. I'll have him come on and we'll talk to him specifically about that. But yeah, acutely, you sprain your ankle, absolutely. Or the other thing I always tell people, if this injury is going to put you out for a long time, probably doesn't matter, right? Like when I injured my shoulder, I knew I'm not swimming for like 6 to 8 weeks. So putting an ice bag on it now, it's not going to make a difference, right? But and more of it was just for pain control. I mean, I couldn't sleep, I couldn't do anything. So yeah, and same with like an anti-inflammatory. Probably at that point, doesn't really make much of a difference because I'm not thinking about, well, in 2 or 3 days, I'm going to be ready to go again.
Okay, so the inflammation part is interesting. So we're not going to do the cold water baths afterwards unless we need to just not have the pain.
Yep.
So how about then extending this out to what order should I do my bike, run, and swim?
This is an awesome question, right? This actually, John, could be the most important question we ever talk on our initial. This is after we announced our podcast.
All right.
Because I actually don't think there's any research that's good on this as far as long term, what's going to make me the better triathlete 6 months from now, a year from now, 2 years from now. But if you think about it and you really think about it, what are we trying to do? Are we trying to be long-term good triathletes or short-term good triathletes? Well, most of us, I think long-term, at least people that would be listening to this podcast, right? They wouldn't be like, I'm just going to do one triathlon the best I can. I'm never going to do another one. Well, there are people like that, right? And in that case, it could be a different answer. But I would argue that probably we would look at what creates the most inflammation and when, and what creates not even most inflammation, what fills that beer stein the quickest.
Yeah.
So the thing that fills that beer stein quickest is absolutely running.
Yeah.
Right. And it really has to do with, we get the most muscular breakdown with eccentric contractions. So eccentric contractions are contractions that we're contracting the muscle as it extends. So it's basically slowing things down. So when you're running downhill, every time you're slowing yourself down, even running flat, you're still slowing yourself down on every step. That creates the most damage and needs the most recovery. Now, biking is really interesting because biking basically has no eccentric component to it, right? And so therefore, biking creates actually very little muscular breakdown for the same amount of time. Now, don't get me wrong, you start going 3, 4, 5 hours, you'll still get breakdown. It just won't be as severe. So filling your beer stein takes longer cycling. Swimming is also very similar. Swimming is almost all concentric as well. Okay. And I would be willing to say that swimming is probably the least amount of filling up your beer stein. Okay. But if you run first and your form sucks on your swimming because you got no kick, because you're all beat up from running, maybe not the best way to do it. But then again, maybe if I'm just hypothesizing, maybe if you ran and then directly swam right after, before you got sore, right? Because there's a window there where you're warmed up and you can pretty much do anything as long as you don't get too stiff, I guess. It might be okay to do. But I would really think about what fills that beer stein and what empties it. And the only thing that really empties it truly is rest. And rest, proper nutrition.
Yeah, well, the nutrition part is a part that we probably need to bring back our sports nutritionist and talk about.
So John, you asked me the order now. So
yeah,
it would really depend on when you're going to rest, right? And how much rest are you going to have, and then how much effort are you going to put into your run? How much effort, how much damage are you actually going to do? Because I would contend that for the average triathlete that's doing this on a regular basis, you go for a half hour, 40-minute run at an easy pace, it's not going to do much. You're not going to fill up that Stein very quick. But if you do a 40-minute run that's, sub threshold or above threshold, you're going to do a lot of damage,
Mm-hmm.
right? And you're going to fill up that cup. Then it might not take, too much cycling to keep getting it even further, right? And then I also do think that we're talking purely about, the overuse side, that swimming probably has very little to do with the other two.
Yeah.
So
Well, I know
that's,
anecdotally, when I do my long run, I always do my bike and my swim after that for, that recovery reason. And, I put swim last because that is a sort of a recovery time. And same thing on when I'm going to do my long bike, I do that first, and then I'll do a break afterwards, and then swim after that. So I do reverse order. But if I'm working on my swim, I have that first, and
yeah,
then
it's whatever you're working on, honestly. Whatever, like, of the swim, bike, and run that you at this point feel is the most important
mm-hmm,
is what you should be doing fresh.
right.
And for most people, they're going to have one or two important hard sessions a week,
Mm-hmm,
and that's what you should go into fresh, and that's should be the day after your off day. Or if let's say you ran morning on Monday and your hard session on Tuesday is a bike, maybe you wait till the evening or afternoon to do it. So you've got, like, 30 hours in between, and you make sure you have a good sleep in between.
mm-hmm.
And honestly, like, that's the balance that we're always trying to find in triathlon by doing, 10 to 12 sessions a week, which is, probably not the best thing for us.
Well, and that's the fun of it too, because on one hand, you're spot on. Put the session that you want to do, get the most training out of first, but then there's times where you want to do something before another event
Yep.
and practice that. So obviously a brick, a bike run. I mean,
Yep.
that is all about practicing how to run after.
Yeah, but here's the thing: is that you're trying to run fatigue,
Mm-hmm,
right? So you're actually, that's what you're looking to do in that session,
mm-hmm,
right? You're not, but here's the thing: is you're not going to do your brick and make it a quality session of intervals,
yeah,
right? You're not going to say, hey, I'm going to do my brick and I'm going to do an hour at race pace.
yeah,
Well, maybe you would. It's
mm-hmm,
not an uncommon thing to do at an Ironman, right? Would be to do an hour race pace at Ironman pace, but
mm-hmm,
your Ironman pace might not be that fast, right? The average Ironman pace for an age grouper is like 10-minute mile.
yeah,
It's not that destructive, right?
mm-hmm,
Where I'll say this, you're not gonna do it at an hour of sprint triathlon pace,
mm-hmm,
where
mm-hmm.
you're actually gonna do significant amount of damage. And we need to think about that. And when you're building your program, I think the mistake that I make, that many people make, is thinking about the sessions, the individual sessions, and not thinking about the load that's being built and taking away the load. Like, how much am I bringing back all the time? How much rest am I getting in between? And that we talked about, building these things in Training Peaks and in Strava and different ways we can build these things, but really paying attention to ramp rate and really paying attention to, not ramping too quickly, and to prioritizing recovery and having weeks of recovery. I've been dabbling with, and the ideas of, having run blocks and having swim blocks and having bike blocks, where we do 6 to 8 weeks of really working on just cycling, and go 6 to 8 weeks of really working on just running, and prioritizing things to keep that, once again, that beer cup, somewhere in the middle,
Yeah.
not too high, not too low.
So it's interesting, if someone, tuned in late and just popped on and listened to us now, they're like, how is this related to the whole ice and the cold water immersion? But that's where we started. And really, well, this is an interesting topic because it is all about trying to figure out that right training stress. All right, so now bring us back home, because we're at our hour. bring us back home and tie it all together. So I'll start with acute injury, ice, but within 6 hours.
Yep.
Okay.
So I'm going to bring back the one little analogy. I actually just thought of this.
Yep.
So I think what ice could potentially be doing in the, especially like the cold water immersion, and we're thinking about long term, is it might actually be freezing our beer cup.
Ah, okay.
Okay. So one of the things we talked about is getting the beer out of it. That's the recovery, right? So if it's frozen, can't get that beer out of it.
Oh,
But that's the analogy if you've been paying attention the whole time.
all right.
But realistically, the time to do cold water immersion is number one reason is if you are you're racing or you've been in a really hard session in hot weather and you want to drop your core temperature. And it doesn't take 53-degree water. You could do it in 70-degree water. You know, you could, John, you're well known for jumping in your pool, right? In the summer, it's still 80 degrees in your pool, but it drops your core temperature relatively quickly.
Yep.
So that's one reason to do it. The other reason is if you finish a race and you don't care about the training impact, right? You're just like, I want to cool down. I just want to feel better. I don't want my legs to be as sore tomorrow. Absolutely. Probably a good thing. Yep. If by some reason you find yourself in Super League racing and you have to do 2 sessions in one day, or your kids play soccer and they got a tournament and they're playing 4 games in a weekend, absolutely. Cold ice tubs, think that'd be a great thing to do. Other than that, I don't see much benefit, at least what I'm seeing in the literature and what I'm seeing clinically. I'm not practicing clinically very much right now, but I'm obviously working with a lot of people that are. Our students are interning with these people. Clinically, it's not really it's not a thinking man's thing to do anymore. Yeah. People still do it, right? And some people honestly still do it because it's the way we've always done things.
All right. So then on the flip side, I should start thinking about warm water immersion, and the jury's still out on this, but possibly doing hot tub after workout. Yeah,
especially if you're trying to acclimatize. Right. Let's say, John, last week was Kona, right? And we didn't live in Las Vegas where it's been unbelievably hot. And you were preparing for Kona, I would see no reason why after your long run, you wouldn't get in the hot tub for a half an hour and just sit there and do some like moderate exercise to keep your heart rate up and increase your blood plasma volume. I think that would be perfectly acceptable. I can tell you this, after I Everested, I absolutely got home. First thing I did was get in a hot. Mind you, I was shaking, freezing cold.
Yeah, right.
But it definitely felt good. I'm not gonna.
Well, I am going to do a hot tub after this.
Nice. So, nice. Yeah. So, well, I thoroughly enjoyed that talk. Yeah. And here's the thing. I can tell you this, and then we'll finish off with this. This is not settled science. Yep. This is evolving. There are many pieces to this. I'm sure that there are going to be people listening that can find articles that refute everything I said. But I'm looking at the body of literature, like the 220 articles that have been put together. And yeah, some of them are going to say one thing, some are going to say the other. And I'm taking if we're going to talk about evidence-based triathlon, evidence-based in the clinical world has 3 pillars to it. And maybe we should end with this.
Okay.
Number 1 is what the literature says. Okay. Number 2 is what your clinical experience is. And in this case, what your experience is. And number 3 is patient preference. Okay. All of those things are evidence-based. It's not just the literature.
All right.
Okay. So I'm approaching it from all three of those pillars.
I like that.
And so yes, I can find evidence to refute it, find evidence for it, but I also have clinical experience and patient experience. And I think that's important to remember as we delve into this podcast, that evidence does not always just mean what some research papers say.
That's right. And when something's published, that doesn't mean it's fact. It's just one step of the scientific process. So I
Exactly.
love it. That's a great, I like that model.
All right. Awesome.
Hey, I've learned some stuff tonight. So this
Well,
is great.
good.
Yeah, no, this is great.
Well, that's what it's all about, right? If we can learn, if we can learn from each other,
Yeah.
hopefully others can learn along with us.
All right. Hey, good talking, and have a good weekend.
You too.